Good afternoon and welcome. I'm Dr. Ashu Danjo, and I'm a member of the Northwest Arkansas American Heart Association Board of Directors and a cardiologist at Northwest Health. Thank you so much for joining us today here. Today, we're getting you ready for a virtual Go Red for Women experience on June 25th with our first of 3 heart health breakout sessions, the Talk with the Doc. I've gathered 3 of my colleagues together for a Q&A. I'm going to ask a few questions to them, and then we'll open it to the attendees to ask questions. You'll place your questions in the chat box, and we'll take them as we go, depending on the time. Before we get into the discussion, I want to take a moment and thank our sponsors and donors who have so generously supported Go Red for Women this year. We thank all of our sponsors who are recognized on the screen for supporting AHA's community work, including our top sponsors, CVS Health, Go Red for Women's national sponsor, Life is Wise sponsors, Northwest Health and the Emerson Group, Healthy for Good sponsor, RB, and signature sponsors, 3M, Bayer, GSK, and Paris Presence. We're especially thankful to Northwest Health, who's sponsoring today's Go Red Heart Health Series event. Let's introduce the panelists now. I would like to introduce the wonderful panelists and my colleagues that are joining me today. First, I want to welcome Dr. Maria Baldester, who's a fellow cardiologist. She's a board-certified interventional cardiologist affiliated with Northwest Health at Bentonville. Her clinic is located at 2900 Medical Center Parkway, Suite 240B in Bentonville, and she's currently accepting new patients. She completed her internal medicine residency in Philadelphia and then completed interventional cardiology fellowship at Cooper Medical School of Rowan in Camden, New Jersey. She was the first female to do interventional cardiology fellowship there, which we're really proud of. Next, I want to welcome Dr. Michelle Poland, who's a family care physician. She's a board-certified family practitioner affiliated with Northwest Family Plaza in Springdale. She completed her family practice residency at University of Arkansas for Medical Sciences through AHEC Family Practice Center in Pine Bluff. And lastly, I welcome Dr. Alexis McCollum, who's an OBGYN. She's a board-certified obstetrician gynecologist affiliated with Willow Creek Women's Clinic. Dr. McCollum completed her and gynecology residency at University of Arkansas for Medical Sciences in Little Rock. Thank you for joining me today and helping me further the Go Red for Women's mission of empowering women to take care of their personal health. So I'm going to proceed with our questions today. My first question to Dr. Ann Poland is, we are in the middle of a pandemic. So many changes are happening for everyone, especially virtual meeting like one today. This is also true on how healthcare providers are seeing patients. Telemedicine is on the rise. Dr. Ann Poland, can you please share with us what that looks like for a patient? How does telemedicine work?
So telemedicine is a new thing right now. It provides a great value for both patients as well as the providers. So this could be available using their smartphone or iPad or computer from the comfort of their home. So those patients that are high risk, those who have like complex medical problems, such as diabetes, hypertension, or those patients that are elderly, they don't have to worry about going to the clinic being infected by the virus. So they could just make an appointment, call the clinic or other physicians clinic, they provide all this telehealth with to our different Northwest clinic. New or existing patients can avail this visit. And I believe most insurance pay for their visits as the until the duration of the COVID pandemic. And I know patients will ask how will they do physical exam, which is it's a very important thing in our practice. But some illnesses that could be seen by using just virtual, some simple cases of cough and colds, allergies, rashes due to contact dermatitis by poison ivy, or simple sprain, med refills, medication adjustment. We could just do that through virtual, and we don't really need to do physical exam on the patients.
That's great. Thank you. Now, another question I have here is, when we look at other health-related changes happening because of COVID-19, we have to highlight the reduction of 911 calls that we have observed. And this is not because people are healthier, it's just people are scared. Can you tell me if it's still safe to call 911 or go to the emergency room if need be?
Yes, as always, call 911 if you're really experiencing emergency, not only COVID-related symptoms, as we know, like shortness of breath, cough and colds, fever, but most of the time when a patient is experiencing, a stroke-like syndrome, symptoms like slurred speech, facial drooping, or chest pain related to heart attack, this patient should not delay or afraid of calling 911 because this could endanger their life. And then we could just direct their call if they need to go to the emergency room or call their primary care doctor, but I rest assured them, when they call the emergency department, they all follow the protocol provided by the CDC, Of course, they isolated those patients in the emergency room that have COVID. They isolate those from the normal patients, so they make sure that all the doctors in the ER, all the staff at the hospital wear masks, make sure that they wear their PPE. They use disinfectant in all the beds and all the equipments that they use at the emergency room. So I think, they should not be afraid because, of course, not calling 911 or, not asking for help will just endanger their, their medical emergency, situation.
Thank you. Now, my next question is to Dr. Baldassare. Dr. Baldassare, can you emphasize why it is so important to seek care right away? We just talked about call 911 if you have chest pain. What's the damage that can be done to your heart when you're not seeking care right away? And I want to emphasize right now, as we just talked, that people are not calling 911. So especially in today's pandemic, why is it still important to seek care right away?
So like Dr. Ang Pullen said, you could be experiencing an emergency. I always tell my patients, don't try to play doctor and try to minimize your symptoms. It's very important to seek medical attention right away because you may be dealing with something very serious. Like you said, Dr. Donja, the last, I would say from March to April, we've seen less patients in our emergency room because I think they're just scared. And I've actually seen patients who we would have otherwise been able to do something for them, but they came a little bit too late. And by the time they presented to the emergency room, they're in such dire medical, in a dire medical situation that we really didn't have too much to offer. So, when you're experiencing symptoms like, heart attack symptoms or stroke symptoms, you should not delay. Just come to the emergency room, get medical treatment, because the earlier you come, the sooner we can do something for you. And, for what we see day to day, what Dr. Donjel and I see day to day is people coming in with heart attacks, either small or large heart attacks. But if you delay treatment for these conditions, that can lead to arrhythmias, sometimes fatal, or congestive heart failure. Time is muscle in cardiology, so the sooner you get in, the better your outcome will be.
Awesome. So remind us again, what are the symptoms of a heart attack and how do they differ in women versus men?
So symptoms of a heart attack are usually obviously chest discomfort, either chest pain, chest pressure, chest tightness, shortness of breath, which can be associated with chest pain or not. Some people may experience these symptoms along with jaw pain or back pain or some shoulder, left arm discomfort. Women, however, can sometimes present atypically. Women patients seem to have a little bit more abdominal symptoms like nausea, vomiting. They could experience severe weakness, heartburn, or kind of a burning sensation in your chest can be a symptom of heart disease. Also, diaphoresis or sweating, especially cold sweats, can also be a symptom.
Okay, great. Now, can you elaborate some of the risk factors?
So when we talk about risk factors, we really talk about major and minor risk factors. The major risk factors are high blood pressure, hypertension, high cholesterol, diabetes, and the other risk factors that we talk about, which fall into this category that we call modifiable risk factors, are your weight, obesity, being overweight, smoking is a big one. Obviously don't smoke, don't start. Males have a tendency, we consider the male gender as a risk factor, so to speak. Your age, the older you are, the more at risk you are for heart disease, and also your family history. Just to keep it simple, if you've had people in your family under the age of 55 that have had a heart attack or stroke, these are some things you need to discuss with either your cardiologist or your primary care, and to see what you can do to prevent, to at least slow down or prevent a heart attack or stroke in the future.
Great. Thank you, Dr. Baldasser. That was great information. Now, my next question is to Dr. McCollum. We know that complications during pregnancy can increase your risk of heart disease. Can you tell us more about these risk factors during pregnancy related with heart disease?
Sure. So certain disease processes, most commonly you'll see gestational diabetes and preeclampsia, but also peripartum cardiomyopathy can be both risk factors. So having those can put you at higher risk of developing cardiovascular disease later in life, but they can also be markers, especially preeclampsia can be a marker of certain situations where, as Dr. Baldasser was talking about risk factors, we consider that as something to watch for later in life as well.
Yeah, perfect. Now, I always feel as doctors, we ask a lot of questions, but why is having a conversation with your physician so important? Because I personally feel, especially women, they kind of hold back, they get intimidated by their physicians, they want to share all the things, and later, after maybe 2 visits, they're like, oh, by the way, I also wanted to tell you that. So why is it really important?
Absolutely. I always tell my patients, I feel like my job is not just to fix them or correct them, but my job is to help educate them so that they can navigate this wide world of information and help them to make smart decisions for themselves. If I don't have all the information, then it's hard for me to individualize that advice. So opening up that conversation between myself and the patients helps to navigate that and help me to guide my patients or guide them on, you know, how to make those best decisions and how to make those smart adaptations within their healthcare.
Thank you so much. So Dr. Ann Poland, my next question is to you. How often should someone have their cholesterol checked or their blood pressure checked?
I normally tell my patients, you know, especially those that are new to the clinic, you know, I said, once you reach, you know, it's just like a well child checkup, you know, that you have to at least see your doctors once a year, you know, just to get checked, you know, because most of us, when we don't know whether we have blood pressure issue, you know, unless you check your blood pressure. We don't have any symptoms, you know. By the time you get to the clinic, you know, your blood pressure is way too high, and you know, but you don't have symptoms. So I tell them, you know, especially if you have family history like hypertension, diabetes, and heart problem, you know, at the age of 40, probably they should just come once a year, you know, just to get checked their cholesterol, or just, you know, overall check up, you know, to see not only the cholesterol, but even their sugar. You know, most of us now has, you know, problems with obesity and sugar issues.
So great. So above 40, and if you have any of the risk factors, you should start taking care, you know, checking your blood pressure and cholesterol. Great.
Yes. Yeah.
Dr. Baldassare, what steps should one take if they have health concerns? Do you need a primary care physician's referral to see a cardiologist?
So if you're concerned about your health, the first thing you need to do is obviously make an appointment with your doctor. If you don't have a doctor, then you know, you can either ask your insurance company who they recommend, or a friend that you trust, that, you know, or a family member. Usually that's who, you know, I end up going to, is whoever my friend ends up going to, essentially. And then making that appointment is the first step. And then, like Dr. Ang Poland says, you know, if you're relatively healthy, it's just a yearly follow-up. In terms of seeing a cardiologist, most of the time you do need a referral from your primary care provider. The reasons why are, you know, sometimes it is difficult to be seen by your cardiologist right away. Some of the workup can already be started by the time you see a cardiologist. And, you know, when you go see your PCP or your family doc, if they're, you know, concerned about your symptoms, they may even refer you to the emergency room or make a few phone calls, get you in the next day. So it's very important to utilize your primary care provider there to support you and keep you healthy, essentially.
Great. Thank you. Dr. McCollum, what are some ways women can take control of their health and work towards prevention?
So in addition to what's already been mentioned here, this regular care is really incorporating into that regular care that open conversation. Have an idea of what you're hoping to accomplish. Make a list of that before you come in, because we always start in and we have thoughts of everything. So make a list, know what questions you have coming in so we don't forget to address those. Making sure you're staying up to date with all of your preventative care. I know we're talking about heart health, but your mammogram, your colon cancer screening, all those things are just as important. So be proactive and take care, and, you know, take charge of it.
Great. And I love when you said that make a list of all what you want to talk, because I always encourage my patients to do that. And sometimes I am like, oh, why did I say that? Because they're a huge list. They're like, by the way, I have 20 questions. I'm like, oh my God, okay.
You might have to break it into a few sessions.
Yes. But, you know, then you don't remember stuff like when you go home and call.
Absolutely.
So at this time, I really want to open the floor to the audience for questions. You can please type them in the chat box and I will direct them to our panelists. While we're waiting for our participants to send us any questions, Dr. McCollum, do you want to mention something about the, hormone replacement therapy, postmenopausal? Because sometimes I have older patients who have heart problems, and they ask me, how safe is it, and should they go on it? And I bet a lot of us have questions about it.
Absolutely. So, that being said, this is a really big area of research right now in women's health. So there's a lot of evolving and there's a lot of active studies out there. So hormone replacement should never, or we have no evidence that it should be used for the prevention or treatment of cardiovascular disease or heart disease. However, there's some information that points towards possible help if started in the right time and individualized to the right person. So this is something that's very much an individualized approach. And so we need to take into account your family history, cardiac risk factors, as well as your symptoms, because not everybody even needs it. So I oftentimes will take that in, and and oftentimes coordinate care with the patient's primary care provider or cardiologist to make a shared decision.
All right, so we have a few questions now. So my first question I'll direct to Dr. Ann Poland. During COVID, what are some good ways to stay active but not compromise our safety? So how can we stay active but, maybe not exposed to other people that,
So it's still safe to go out, in the park, as long as you wear your mask, and still do social distancing, But of course, if you don't practice those things, then your chances of getting the virus is higher compared when you protect yourself from just wearing the mask, But you can still be active by, hiking, going to the park, walk,
Yeah. How about another question is that I'll direct to you. If I'm 60 plus and I have type 2 diabetes, should I have my blood pressure or cholesterol checked more often?
Usually what we do here in the clinic, we check your A1C, and if it's abnormal, then we ask you to review, your diet, maybe you can consider eating healthier, avoid too much sweets. And then, being compliant with the medication is also important thing. If their A1C is above 8, we tend to tell them to come here regularly, at least 3 months, so we could just, adjust their medications based on, on their A1C.
Okay.
And then the cholesterol, at least probably every 6 to a year,
Okay. So somebody who has uncontrolled diabetes, you need to check them more often than somebody who has well controlled. Okay. Dr. Baldassare, what do you think is the most commonly overlooked cardiac issue?
I think the most overlooked cardiac issue is, well, I'm going to say two. Is one is hypertension, and the other one I'm going to say is sleep apnea. Hypertension is one of these things that I see where somebody will come in referred for something else. They don't have a history of hypertension, but then you repeat their blood pressure. The first one is a little high. You give them 5 to 10 minutes, and then it's, you recheck it again. It's still a little high. And then, before the visit, is over, at least I am obsessed with the blood pressure. I'm at least maybe stage 2 hypertensive at this point. And you kind of broach the topic of medication. It's kind of like, no, I'm not going to, take a medication. I'm too young, or I don't want to take a medication. So I think hypertension is something that's definitely overlooked. Usually what I do is if I end up seeing that's a little high, we usually refer them either to their PCP to have it rechecked, or if they don't have one, rarely I see some patients who don't have a PCP, have them come back in a couple of weeks to recheck their blood pressure and really see. But I think that is one that is missed sometimes.
So let me ask you another question. You just mentioned that people don't want to take medication. So what are other ways to lower your blood pressure without medications?
Sure. The biggest one is getting off your couch and getting up and doing something. The American Heart Association recommends at least 30 minutes of moderate intensity exercise 5 times a week. So this means, getting out there walking so that you're a little bit short of breath, but can still carry on a conversation. Losing, I believe it's 1 kilogram drops your systolic blood pressure about, 1 to 2 points. So exercising is huge. Obviously losing weight goes along with exercising. So weight loss is a big factor in at least staving off blood pressure medications. I mean, I've had those patients we see them rarely, that are motivated, lose 20 pounds and then their blood pressure is back to normal. That only goes to a certain extent, because if you do have a family history of hypertension, I've seen patients who are skinny and are hypertensive. So there are things that you can do. The second biggest one besides diet and exercise and weight loss is obviously minimizing your salt intake, keeping it 2 to 4 grams or 2,000 to 4,000 milligrams per day. Diet pop is a big source of sodium. So that's the first thing you can do to try to get towards that healthier lifestyle. And right. I had mentioned about sleep apnea. That's another one that is, I think, overlooked. It's important in our world as cardiologists because, this is where some of the atrial fibrillation comes from in younger people. And this is also some of the reason why people have resistant hypertension. So it's very important to at least see somebody yearly so that some of these things can be teased out.
Okay, great. Now you mentioned atrial fibrillation. One of the questions participant has asked is, are there any new treatments for atrial fibrillation other than blood thinners? And I know you're the perfect person to ask that question.
I'm an AFib geek. So in terms of atrial fibrillation, blood thinners have always been the mainstay therapy just because it is a big way to prevent stroke. When somebody's in atrial fibrillation, their left atrium is not contracting normally, and you can cause a stagnancy or a blood flow issue, which causes pooling to happen and clots to form. And this is why people with atrial fibrillation are on blood thinners, to prevent that pooling and that clotting so that we can prevent strokes. There are some people who are just not a good candidate for anticoagulation or blood thinners. They do have new innovations out there to close the left atrial appendage, or this pouch on the top chamber of your heart, to get people off of blood thinners. So if you're, somebody who has had bleeding issues, or one of your mom or dad has had bleeding issues, or they're just so frail, you're afraid they're gonna fall and, they're gonna be on warfarin or Eliquis, there are other options procedure-wise where we can close off this little pouch that collects, that forms clots when you're in AFib, and potentially get people off the blood thinners.
Great. Well, thank you so much. Dr. Ann Poland, a couple of people have asked that, do heart patients, or as a matter of fact, anybody, should be concerned about wearing masks for long periods of time? Or what kind of activities can they do in a mask? Sometimes, and my patients have told me, it gets difficult to breathe wearing masks and trying to be active.
I think what you can do, if you're getting short of breath, probably you can just take it out a few minutes and then try to get hydrated and, take some deep breathing exercise before you put back your mask. I understand that because in our practice here in the clinic, we use the mask at least 8 hours a day, and in between patients, it's hard to take it off, jumping from one room to another. So the only time that I take it out is when I go to the break room.
Thank you. So another question is, I think it's pretty interesting. As workplace return work recommendations are formulated, often those in high-risk category are being told to come back in later stages of increased number of people in the office. The question is, those with high blood pressure are still considered in the high-risk group. Now, does that apply to those on medications to control high blood pressure? Are they still considered high-risk group? Dr. Poland?
I myself has hypertension, but of course, first thing is you just have to really do what you can do at the workplace. Prevention is the key important in spreading the illness. So wash your hands frequently, do not touch your eyes, nose, and mouth. Social distancing, and then wear a mask. Make sure that you take your medications diligently, to prevent, making your blood pressure to go high, and any one of us are risks, of getting this virus. But, we just have to prevent the spread by doing what we can do, not to get the virus.
Right. Well, thank you so much. I think we're running out of time to take any more questions now. So I want to thank my panelists, Dr. Ann Poland, Dr. Baldassare, and Dr. McCollum for joining me today. And thank you for all the GoRed supporters. The next GoRed Heart Health series will be on June 16th at 4 p.m. with the topic of reducing stress, and we'll have some fun with a Freeman face mask expert. The final session of the series is on June 19th at 1 p.m. Brooke Robinson will lead you in an at-home workout, and there'll also be a hands-on only CPR demonstration. Visit Northwest Arkansas gored.heart.org for more details to register for the series. And enjoy the rest of your day. Thank you, guys.
Thank you.